Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. More funding and more ways to get there is what we're looking at with this new piece of legislation. I wanted to jump into it. This is a bipartisan approach here, and wanted to share it with you. So please hit the thumbs up, subscribe, share with a friend, all that good stuff. I really appreciate it. If you're new to the channel, thank you for making it. If you want to support the channel in other ways, please consider becoming a member. It helps me to find you quicker in the comments, and it really does support the channel. You can do so by going to the home page. You will see the highlighted members section, and you can join there. All right, so let's jump into it. Today is, what is today? Today is the 9th, and this just came out on the 7th. Senators Ossoff and Collins and Thune, I'm not sure, Thune, introduce a bipartisan bill to help veterans in rural areas access VA health care. All right, so bipartisan bill would help expand transportation options for veterans living in rural areas to get to Veterans Affairs healthcare facilities. The bipartisan bill is backed by Veterans of Foreign Wars, American Legion, and Disabled American Veterans, the DAV. It says here, U.S. Senators Jon Ossoff. I found this on his page. So he is over in Georgia. So there's a little plug for Georgia. So U.S. Senator Jon Ossoff is introducing a bipartisan bill to help veterans in rural Georgia to get to the VA. Today, Senators Ossoff, Susan Collins, and John Thune, I'm not sure, Thune, introduced the Rural Veterans Transportation to Care Act to help more veterans in rural areas get transportation to VA healthcare facilities and access the healthcare benefits they have earned. And now there's some money in here, grant recipients. So it looks like if you want to help in this mission, there could be some money there for you as well if you're somebody who can help in this arena. So let's dig in a little deeper here. Senators Ossoff, Collins, and Thune's bipartisan bill would expand veterans' eligibility to VA's Highly Rural Transportation Grant Program, so the HRTG, Highly Rural Transportation Grant Program. Now, I'm throwing this out there. If you're interested in becoming a recipient of that grant to supply services, you'd probably want to check it out. Highly Rural Transportation Grant Program with the VA, which provides grant funding for veteran service organizations and state veteran service agencies to provide veteran transportation in eligible counties. Now, I know that there's a lot of people that work at different various organizations, including veteran service organizations and veteran service agencies out there. So this could be a way to pull in some additional funding into your program. All right. The VA's Highly Rural Transportation Grant Program is currently only available to counties with fewer than 7 people per square mile. 7 people per square mile. The bipartisan bill would expand the VA's definition to ensure more counties are eligible for the grant program, helping more veterans living in rural areas get transportation to the VA or a VA-authorized healthcare facility. The bill would also increase the maximum amount of funding grant recipients are eligible for, from $50,000 to $60,000 or even up to $80,000 for grantees to purchase an ADA compliant vehicle. Imagine that, being a veteran serving organization in a rural county and getting $50,000, $60,000, $80,000 to be able to purchase an ADA compliant vehicle and provide that service for your county's veterans would be fantastic. There's a couple quotations. As I've sat down with veterans in rural areas across Georgia, one of their key concerns is lack of transportation, Senator Ossoff said. That's why I'm introducing this bipartisan bill to ensure veterans have more access to transportation services that can bring them to VA clinics and medical centers to get the care they need. In Maine, a large rural state with one of the highest number of veterans per capita, only veterans living in one particular county are eligible for this important grant program that provides transportation to VA and VA-authorized healthcare facilities, said Senator Collins. By expanding program eligibility to include more highly rural areas, this bipartisan bill would allow veterans in additional main counties to gain access to these transportation services. Outstanding. Next one here, traveling to and from VA facilities is oftentimes an overlooked obstacle that veterans in rural communities like those in South Dakota face, said Thune, I'm still messed up, I don't know, Thune. This legislation would provide South Dakota veterans with much needed transportation services that would allow them to safely and efficiently utilize services at VA facilities. The bipartisan bill is backed by the Veterans of Foreign Wars, American Legion, and the Disabled American Veterans, the DAV. Our nation's 2.4 million veterans living in rural areas face difficulties accessing VA health care that those living in urban and suburban areas do not. Chief among them is transportation to the department's nationwide medical facilities, said Nancy Espinoza, DAV National Commander. The nearly 300,000 veterans living in areas considered highly rural face even greater obstacles and deserve increased attention to transportation or attention and assistance in accessing VA's highly quality health care. DAV is proud to support Rural Veterans Transportation to Care Act, as it would help VA provide all rural veterans better access to treatment. We applaud Senator Ossoff's leadership in introducing this important legislation that will help ensure our nation keeps its promise to American veterans. According to the VA, roughly 3 in 10 veterans in Georgia live in, and again, I found this on Senator Ossoff's website, so that's why he's pointing out Georgia. So 3 in 10 veterans in Georgia live in rural areas, and there are roughly 2.8 million veterans in rural areas across the country who are enrolled in and rely on the VA's healthcare system. Senator Ossoff continues working to improve the health of Georgia veterans and, by default, all veterans. 2 weeks ago, thanks to Senator Ossoff's Bipartisan Access for Veterans to Records Act, the National Archives cleared its backlog of more than 400,000 records requests, which I did a video on, covered that, enabling Georgia veterans, and again, by default, all veterans, more quickly access to their records and claim their benefits. Last month, Senator Ossoff and Rick Scott from Florida introduced a bipartisan Schedules Act, which would require the VA to establish a time standard between medical referrals and appointment times at VA hospitals and community care centers. In October, Senator Ossoff launched an inquiry with the VA into excessive delays with the VA Board of Veterans Appeals, which decides whether or not veterans are entitled to claimed veterans benefits and services, which is part of the appeal process. So that is it. Again, it is called the Rural Veterans Transportation to Care Act. If you support it, reach out to your representatives, your senators, and your congressional member on the House side and let them know that you support the Rural Veterans Transportation to Care Act. Thanks so much for watching. I appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.